tuberculosis is a really nasty disease. Okay? So again, we're talking about sensitivity versus specificity. A lot of times they would have to go in there and do a biopsy of that in order to make sure that it wasn't cancer. Usually single nodules like that are highly suspicious of cancer. Okay? It says the biopsy proved it was, okay, was normal, was not something to worry about. Well, something to worry about. Tuberculosis is definitely something to worry about. And this is another thing here. Okay, you have a patient that's getting pneumonia, and if you notice that the activity in the normal tissue is about the same as the activity in the lung. Okay, that's what they mean. The standard uptake value is 1.1. So usually when it's like that, you don't think malignancy. We normally think that cancer has a much higher metabolic activity. Okay, over here, standard uptake value, here's the pneumonia. Okay, 3.3. Under normal circumstances, without a patient history, if I saw that, I would say it's probably a malignancy. Because usually anything above 3 is considered highly malignant or highly suspicious for malignant. Okay, here you have one little area over here, and this is tuberculosis, granulomatous pneumonia. Okay, again, 9.8. Man, if I saw that without having a patient history, I'd say get this guy, it's cut out his lung because he's got cancer. Okay, but now you understand what we mean by specificity versus sensitivity. You can definitely tell there's something there, but it isn't necessarily what we think it is. Okay. But anyways, like I say, if you do have, you put all the temperature and things together here. So it says promising for fevers of unknown origin. You now know what the definition of a fever of unknown origin is, right? So what is it?
Cyclic fever going up and down for 3 weeks.
Yep, cyclic fever going up and down for 3 weeks. So.
Test next week.
That's next week. Okay, good for osteomyelitis. And the main reason why they probably don't do it more frequently is because they don't get paid for it. FTG has not been approved for doing infection imaging. Okay? So, we have multiple radiopharmaceuticals. Okay? And, like I said, the ones that I'm most interested in you remembering for infection imaging, indium-oxime labeled white blood cells, and they're the best for acute infections. The technesium white blood cells, mainly for abdominal imaging, okay, because you only have that 2 to 4 hour window from the time you prepare the white blood cells, inject them and scan. You have 67 gallium. Okay, it says antibody assessment. Don't worry about CD15, okay? They're not using it, and it's been kind of taken off the list. It says gallium-67, the best agent for diffuse pulmonary infection, and better for white blood cells. Because remember, white blood cells don't go to your spine, right? You don't normally see white blood cells in the spinal canal. If you do, it's very unusual. Okay? And then FDG PET-CT may be able to use that for infection. So let's see what we have here. What else do we need to discuss?